Compassionate intent gone totally wrong.
Oregon has always been known for its unique perspective, whether it's leading the nation in recycling bottles and cans or looking at healthcare issues and creating the Oregon Health Plan years before the debate began. We are always independent in our thoughts and collective decisions. In 1998, Measure 67, which allows the use of medical marijuana, passed 55% to 45%. By allowing people to use marijuana as medication, the voter once again showed how independent they can be. The law was amended by legislature and the governor in 1999 and again in 2005. In each case, the amendments were influenced by proponents of the bill with attempts to clean up some ambiguity, but it also increased how much marijuana a patient can have and how many plants a grower can produce. State, county, and city law enforcement, like the voter, have compassion for people with illnesses who are helped by medical marijuana. However, amendments have created a nightmare and a huge business for abuse that has blurred the intent that the voters approved in 1998. Let's look at statistics on where we are today. As of January 2011, there are more than 38,000 patients, nearly 20,000 caregivers who can transport medical marijuana, and more than 10,000 pending applications. In 2010, there were more than 24,000 applications, and 1,305 were denied. Currently, 3,715 physicians have recommended patients for medical marijuana. As of February 2010, a handful, just 10 of the 3,715 physicians, made 59% of these recommendations. One doctor has nearly 8,300 recommendations, or 25% of the total. To put those numbers into perspective, that one doctor would have to see 32 patients a day, 5 days a week, for an entire year, diagnose them for the need, and prescribe medical marijuana. It's clear that those abusing the system have found the doctors who will prescribe the drug easier than responsible physicians. The caregiver relationship is worth looking into. A caregiver has significant responsibility of the patient's well-being. The caregiver can transport the medical marijuana for the patient with little oversight, creating temptation for abuse. Look at this photo of a caregiver's grow site with multiple patients and growers. Note the size of the plants as compared to the people in the photo. There are 22,771 registered grow sites in Oregon. There are several illnesses for which prescriptions for medical marijuana are being recommended. Less than 50 for Alzheimer's, 534 for glaucoma, 654 for HIV and AIDS, 857 for cachexia, 974 for seizures, and more than 1,500 for cancer. These sicknesses were the ones we thought we were voting to help. Now look at these. 5,049 for nausea, 8,225 for persistent muscle spasms, 34,303 for severe pain. All very broad illnesses, unlike the ones we thought really needed a prescription for medical marijuana.
It's all about the economics. Follow the money.
Not everyone using medical marijuana is abusing the system for profit, but the current law opens itself to abuse. The financial gains are huge, and the drug traffickers are creative, resourceful, and manipulative. First, we must look at the committee overseeing the Oregon medical marijuana program. It's an 11-member committee made up of the following: registered patients, designated primary caregivers, people responsible for grow sites, and advocates for the Oregon Medical Marijuana Act. There is not a requirement of people involved in drug treatment, the medical community, law enforcement, prosecution professionals, defense professionals, and judges. Who decided this? Is this what we intended? Did we want to allow the very people with access to medical marijuana to oversee the program? Where are the checks and balances? There are rules within the law that make it difficult for law enforcement to separate the legitimate user from the system abusers. If the police want to follow the trail of the medical marijuana from the cardholder to the caregiver to the grower, that information is not attainable. This makes it very difficult to keep an eye on any abuses. Law enforcement needs to monitor the activity to ensure the law is being followed. It gets a little confusing, but let's walk through an exercise illustrating the challenge with compliance verification. An officer has an individual with 72 ounces of usable marijuana in their possession. They claim they are a caregiver for 3 patients, and the OMMP staff verifies that is correct with no way to identify the grower and the patient. So the assumption is that there is no medical marijuana inventory in the possession of either the patient or the grower. The grower is allowed to possess the same 72 ounces as well as the patient. So for a caregiver of 3, there is now a potential 216 ounces of usable marijuana in the pipeline with no control over whether the consumption of the product is only for the patient who can legally use it. That's 13.5 pounds of marijuana. There is also too much temptation because the profits are so large. The amount of marijuana allowed by a grower for 3 is equal to $15,000 in street value marijuana in our area. In places where it's completely illegal, it's worth as much as $90,000. We also need to look at the relationship between the patient's inventory and the grower's inventory. Currently, the patient is allowed to have in their possession 24 ounces of marijuana. The grower is allowed 6 plants and 18 seedlings to create the inventory to meet the medical needs of the patient. What is happening is that the growers have figured out growing methods to create much larger plants that produce excess inventory. Once again, the system is creating the temptation for abuse. And finally, there is no consideration to neighbors and land use laws for grow sites. Marijuana grow sites are popping up next to parks, schools, and in residential neighborhoods. And under the current Oregon law, a person at any level of the OMMP is exempt from prosecution for endangering the welfare of a minor or from child neglect in the first degree. Essentially, the proponents of the Oregon Medical Marijuana Program are now in charge of the program and the law. They ensure little program oversight, they limit record disclosure that help control abuses, they create the temptation and the reality of abuse, and create more marijuana inventory than is required for the compassionate care requested by the voters of Oregon.
Why is Jackson County taking a stand?
In 2010, Jackson County commissioners, in working with law enforcement, started to realize that much of the criminal element and abuse were falling into our area. The frustrations with this growing problem created a request to deal with some of the ambiguity in the law to help law enforcement control the criminal element associated with the abuse. Like the voters, Jackson County commissioners were not concerned with the legitimate use of medical marijuana for those it can truly help, but due to our climate and soil profile, our area is considered one of the best areas in the world to grow marijuana. Criminals know that with manipulation of the current OMMP laws, they can produce untraceable excess inventory and sell on the streets for huge profits. Here is another telling illustration of how the medical marijuana program is creating unbalanced growth in Jackson County. In February of 2010, there were almost 4,500 cardholders in Multnomah County, slightly more than 3,000 in Lane County, and Jackson County had 2,931 cardholders. Although Jackson County has 28% and 59% respectively of those larger communities' population, we have 66% and 98% respectively of their number of cardholders. We had more than 1,000 more cards than Clackamas and Washington counties, and neighboring Josephine County was 4th in number of cards. And the problem is growing. As of January 2011, just 10 months later, it is reported there are now 6,626 cardholders in Multnomah County, almost 4,200 in Lane County, and Jackson County has 4,898 cardholders. We now have the second most cards in the state of Oregon, although we are 5th in population. The criminal element has truly found a home in Jackson County. So the Jackson County Commissioners have asked Jackson County Administrator Danny Jordan to look at the current law and make a recommendation for changes that would keep the criminal element of this legislation off our doorstep. There is current legislation in Salem that deals with the issues we have seen in this presentation. It deals with tightening up the looser defined illnesses that are creating easy access to an OMMP card, controlling the abuse of some doctors that excessively prescribe medical marijuana, adding more people to the oversight committee that deal with drug addiction, and adding more doctors that understand when it should be prescribed, decreasing the size of grow sites to limit abuses, keeping grow sites away from schools, giving law enforcement more authority to inspect grow sites for compliance, not allowing cards to be held by minors without supervision of a legal guardian, allowing doctors to prescribe amounts needed for treatment on a case-by-case basis, requiring a criminal record check for those receiving cards, creating a period of time after a conviction for a felony before being allowed to possess a card, requiring timely processing of card requests. Notification requirements if the content changes on the application of a cardholder. The temporary suspension of a card when the cardholder is charged with a crime, and quick reinstatement of the card if the person is found not guilty. Decreasing the amount that can be possessed by a cardholder at any one time to lower the temptation of abuse. Giving law enforcement the information needed to monitor and investigate abuse without violating privacy law. Holding participants accountable to child protection laws, just like any other person would be in society. All common sense ideas, but ones that have become lost in the way the program is working today. Jackson County Commissioners, legitimate medical marijuana cardholders, the Jackson County Administrator, citizens and law enforcement agencies all encourage support of new legislation in Salem that will shore up the intent of our independent-minded, compassionate, and thoughtful decision to allow medical marijuana use in Oregon.